evening and welcome to the People's Platform. We're meeting you again after a bit of a hiatus thanks to the FIFA World Cup. My name is Sonali Waniga-Baduge and joining us tonight is Dr. Jude Jaimaha. He is a consultant medical virologist and head of the National Influenza Center at the Department of Virology, Medical Research Institute. Good evening and welcome, Doctor.
Yeah, good evening.
Dr. Jaimaha, we have seen a resurgence in COVID-19 coupled with a fast-spreading influenza virus. People are confused when they fall ill as to whether it's COVID-19, whether it's the flu, whether they should seek treatment, whether they should stay at home. So if you could shed some light on this confusion.
Yes, actually this is a very current topic as well, because towards December as well as in April we do have so-called our influenza or flu season. Before that, let me have a very brief introduction. Influenza, or we call it a flu, as well as COVID. Actually both are self-limiting illnesses.
Okay. Actually
when we get infected, both will actually have a self-limiting course. But when a lot of people get ill, say in a workplace or in a school or university or a place like this, so it has some effects. So that's why we are mainly concerned, as it was quite aware that when COVID was spreading, like first wave or maybe second wave, or during the past 2 years, where a lot of people, say thousands people were affected, then of course we have seen few people died of the disease. So it's very important. So influenza and COVID-19 both present in a similar fashion. Especially fever is there, and so-called sore throat, runny nose, and you feel very lethargic or very tired, and you cannot engage in day-to-day activities. So that depends. That actually we will talk about it and more elaborate about it. Who should seek treatment and who should be very cautious. So usually in a healthy young individual or healthy individual, both are self-limiting, and you need to have adequate rest, and you need to take care of yourselves, perhaps if you have fever, with paracetamol. But those who are having underlying conditions like diabetes or any lung disease or heart disease need to seek treatment early in the course of the disease.
Right. Okay. So another issue that we have in Sri Lanka is that right now mask discipline has dropped across the country, and whilst life and life's activities must resume, and we welcome that, there has to be certain guidelines that are followed across the board, which is not happening to the level that it should. The Health Ministry has issued guidelines continuously. However, as to whether they are implemented in the proper fashion is another question. How do you view this?
Yes, in the sense, like especially you raised this mask mandate, or whether to wear a mask or not. So of course the guidelines are still it is there, and it's really better if you can adhere to the guidelines. But as you mentioned, now returning to normalcy, right? We were not wearing mask or in the pre-pandemic, and of course all of a sudden all were wearing masks, and of course it had maybe some issues. But now of course all over the world globally, those who are having COVID as well as who are coming out of COVID also, slowly and steadily the mask mandate is actually removing, or it's not mandatory. Even for air travel also, it's not mandatory, but it's actually complementary. Now, how I put this, actually, there are two categories that is with a simple and a logical way one should actually understand is two portions or two sides of the coin are there. One thing, of course, if you are ill, you need to wear a mask. If you are having, say, cough or maybe perhaps even allergy, we do not know whether it is actually a symptom. So if you are having runny nose or cough, definitely if you are having fever, you will be at home. So you should wear a mask to prevent whatever you have to spread to others. And then of course if you suspect that you should be protected, right? Perhaps you are in a public transport, or maybe you are in a very close environment. Perhaps you are visiting a hospital or a healthcare setting. If you suspect that I need to be protected from either COVID-19 or influenza or any other acute respiratory illness, you should wear a mask. At the same time, especially if you are having long-term diseases, which will be, of course, we will be talking in detail, especially if you are taking medicine for heart disease, and if you are an asthmatic, and if you have gone a transplant, definitely you need to wear a mask if you step outdoors.
Okay, okay. In Sri Lanka now, the country is trying to attract more and more tourists. The mask mandate will most probably not be brought in, although it is advised that Sri Lankans do wear a mask. As opposed to that, in China, they just did away with their zero COVID policy amidst contention, amidst protests. What's your take on this in terms of the way forward for Sri Lanka and alongside COVID-19?
In the sense, now I actually want to quote our own Sri Lankan eminent professor as well. So, Professor Malik Piris, during a discussion some time back, we do not know, in the sense we do have plans for say 1 year, but it always we need to have it, what is the situation. In Sinhalese also there is thing, according to the whatever the situation only we have to adapt or either upgrade or have strict regulations or downgrade. Now, as you quite correctly mentioned, we are coming out of from this, attract more tourists, and also perhaps have more festives, or maybe have sports like perhaps LPL or perhaps any other sporting event where mass gatherings are there, or perhaps now, of course, needless to say that the festive season is around the corner. So, are we going to have more shopping sprees kind of thing? So, it depends again. Now, for instance, if at all, now Health Ministry has this once in 2 weeks and sometimes once a week media briefing on current affairs. So, time to time, Deputy Director General, they according to the analysis of situation, they will actually recommendations, or they will urge. As you mentioned, it's difficult at the moment to carry kind of a mandate or mandatory regulations as such, but if you have a better to wear a mask, especially when influenza or COVID-19 is escalating.
Right. Doctor, also for the benefit of our viewers, if you could explain the basic differences between the flu and the COVID virus, as well as the reasons behind the flu, how is it caused?
Yeah, flu is actually the general term, it's a lay term that is used for, loosely used for illness having fever, cough and cold. Most of the time it is actually influenza and other respiratory viruses, they do cause it. But of course, COVID also can cause. These, as mentioned previously also, both have similar presentations and similar course of illness. But COVID, of course, it's mainly asymptomatic. COVID, of course, because now into 2020, when we screen lot of contacts, they were having the illness. But none of them actually, majority of them didn't, what you call so-called, didn't show symptoms as such. So it's a mild one. Sometimes, of course, now especially the Omicron variant, they have a sore throat, a severe sore throat as a kind of a predominant one. So now when it comes to influenza, most around 75 to 80% they have fever, along with constitutional symptoms like runny nose, cough and cold. And also flu, influenza and other respiratory viruses or flu more towards lethargic and malaise. Mm-hmm. And of course, if you are not really down with COVID, this body aches and other generalized body aches and very difficult to walk about is very much less. But again, both diseases have similar kind of illness. Unless of course you test, it's very difficult to differentiate from clinical symptoms or outside by just looking at a person, taking a detailed history from the patient.
Okay. What measures can be taken to prevent the influenza virus?
Fortunately, both are same, because in the sense both have droplet transmission as well as now COVID is airborne transmission. That means small particles. If you sneeze or if you cough out from small particles, it can happen. But mainly influenza, larger droplet, and of course when you touch a certain surfaces and infected person touch, and then if you a healthy person actually touch your nose or eyes, one can get infected. So both have the similar ones as far as the prevention is concerned, especially hand washing. It has been proven that washing hands, especially if you take the public transportation or if you go out and if you come to your workplace or you return your home, wash your hands. And then of course, if you are ill, especially if you are ill and you need to either go to hospital or if you are having cough or cold, wear a mask. Because it's a win-win situation. We will also, like, you will not spread the infection, and sometimes during your brief illness, then of course you won't catch another bug.
Yeah.
So the other thing is, of course, if COVID now, of course, the fourth dose, since it's expired, we are not actually taking. If there's another vaccination program, to have the vaccine. And then of course, like if you are ill, please stay at home. In the sense, sometimes of course there may be, now for the term tests are over, but you know, if you are ill, don't go out till you are fully recovered.
Okay. So I think social responsibility is of paramount importance to ensure that you protect yourself as well as others. Yeah. I think that message needs to get out more.
Correct. Absolutely correct. Yeah. Because before this program, actually, I want to relate two stories. I think it's okay.
Absolutely.
Yeah. Because the thing is now, everyone has a kind of a role. This is actually a true story, happened in 2016, where I came across a 16-year-old girl from Hambantota. She had a febrile illness for 2 days, and her class trip to actually Sigiriya, we have been to Sigiriya. She went to Sigiriya against mother's advice, right? During the postmortem, they told that she had a febrile illness, and of course, admitted into a hospital. She was pronounced dead, sudden death. Then they sent tissue samples and all that. Then apparently it was influenza A. Then we retested also, because the JMO, Judicial Medical Officer, requested me to, can you please retest, because she is 16 years old. So that is a new message actually. If you are ill, especially now, we will actually address that also, especially adolescents and young adults. Influenza deaths are common in outbreaks, because the thing is difficult to rest as such. Maybe other commitments, you know, young adults as well. They have to engage in perhaps their studies as well as their occupation. And also adequate rest, and yes, that is another main thing. We will relate another story when it comes to pregnancy.
Okay. So doctor, on those lines, another factor that you spoke of is physical exertion. So for example, when people, young adults have a cold or fever, they would probably take 2 Panadols and go to a gym or do some high intensity interval training workout. So you don't advise this, right?
Correct. Absolutely, yes. Because the thing is now, for instance, this is a self-limiting illness. Now, especially we call natural history of the disease, what will happen to our body. Within 2 to 4 days maximum, fever will subside. But still on whatever the battle, even though battle is a kind of over from outside, fever will subside and perhaps your runny nose will dry. But still, the war is going on, if I put it in a very simplistic way. So, but still our antibodies are produced, and then of course, still the recovery period is there. So, as we are quite aware, we lost few artists and few prominent politicians also due to post-COVID, due to pneumonia. I mean, I don't mention names as such, but due to long COVID, we lost a prominent artist as well as a politician after COVID recovery. But that is a separate issue. But I just want to highlight that definitely, especially the adolescents and young adults, even those who are in their 50s and 60s also, you need to take adequate rest, because in some instances, of course, even flu or COVID can go beyond 1 week. It has been there, especially sore throat. You complain to your general practitioner, doctor, this sore throat is there for 1 month. This is not actually, the responding to even antibiotics.
Okay. So a rest period of 2 weeks?
Yeah, kind of a rule of thumb. That depends in the sense. What we advocate is actually afebrile at least 3 days, recovering from fever.
Okay.
But all won't actually get fever. So if you are having a productive cough, please do stay at home and either take remedies or seek medical advice. And definitely, if you have a runny nose, at least depending on if you take medicine, it's all right. At least make it kind of a dry, and you feel also in the sense like can you take public transport or can you drive and you can engage your this thing. There's no hard and fast rules, but depending on your logic, perhaps.
Yeah.
But having said that, sometimes it's difficult to obtain a long leave, in the sense 5 or 6 days as such. But it depends, how you feel and whether you can take another rest. And also during that period, it's very important to take adequate fluid as well.
Right.
Have hydration.
Yeah. So I think it's important to also listen to our bodies. Sometimes you don't feel well, but you go against that feeling, that instinct, and just proceed with whatever high intensity workouts, etc.
Absolutely,
Yeah.
absolutely. Because now it's actually a fact that sometimes some people do travel. You don't believe, Sonali, 3 hours. They take the train sometimes. 3 hours to their workplace.
Yeah.
It has, it's happening. They
course.
come to Western province from Central province as well as Southern province also. So it's a strenuous thing. Definitely you won't engage in high intensity as such, but that also standing for 2 hours and taking another public transport. So you put it in a nice way. Listen to your body, or yes.
Yes. Let's also talk a bit about home remedies, doctor. These are quite common in the aftermath of this resurgence of COVID-19, influenza. You take coriander, boiled coriander, steam inhalation, all of these home remedies, ginger and turmeric. Is this advisable? Should this be used in complementarity with Western medication? What's
Yeah,
your
allopathy
take?
medicine, actually, we don't actually, straight away discard them, because they are age-old remedies.
Of course.
Corianders and all that. Of course, another thing is your mom, your first physician, I guess, or your grandma. So they will give you remedies. But the thing is now, those very common remedies or first aid you can actually take with plenty of warm water, good hydration, and perhaps according to your weight, or if you're a child, or maybe according to your this thing, you can take paracetamol. And I really advise, if there's a thermometer at home, please have a clinical thermometer. It's 120 or 180, because you need to measure the temperature.
Okay.
Not only pediatrics. I keep on saying this. It's very important to measure your own temperature, because when you feel from a riverside of the palm, you might have feverish. It's subjective.
Okay.
So it's better to have objective. I think people's platform, that message, if I can convey, always measure the temperature, because you can go to your doctor and you can relate that, whether it's 102, whether it's 100, because to your palm it's the same. So it matters actually. In childhood medicine or pediatrics, it's a must. So the thing is, yes, ginger and all that. So it's okay, but you should not take aspirin or non-steroidal anti-inflammatory drugs if you are suspecting influenza, because there's a rare complication or adverse effects called Rice syndrome, where your liver can get damaged because of aspirin and influenza. They are not very good, in terms. There's a bad synergistic action or additive action. So you should not take painkillers, Brufen, and especially non-steroidal anti-inflammatory drugs. since you raise that home remedies,
course,
because
of
sometimes
course.
you get, because there's a very bad, what do you call, adverse effect. Kind of, another takeaway message or a convey message, you should not take unless you seek medical advice.
Wow. Okay, that's very important, I think. Thank you very much. Let's talk a bit about the policy now, Doctor. You are from the Medical Research Institute. I think testing has played a massive role in Sri Lanka in the wake of COVID-19, especially. Speak to us about the role of the MRI in testing.
Yes, in fact, COVID was first detected. We had this so-called in-house test at MRI in 2020, January 25th. We have our own in-house, so-called in-house test with collaboration of Hong Kong University. And the following day, we got the first Chinese patients. Since then, we have tested nearly 300,000. So not only testing, like, monitoring, like especially we go into deep into the COVID-19 as well as influenza and check their so-called gene sequence, whether they have altered, whether altered from the first strain called Wuhan strain. And I think perhaps you might also have come across newspapers that we time to time we say this Greek alphabet, alpha, beta, gamma, and the recent is Omicron, and we further go into. So Medical Research Institute carry out gene sequencing and monitor or closely keep an eye on how the COVID-19 behaves as well. And when it comes to influenza and especially there are other viruses, especially viruses that cause severe childhood disease like respiratory syncytial virus, para-influenza virus, and adenovirus. So we detect them, and we also in collaboration with our global partners, global laboratories, we again, just like this where army intelligence, they take information or they gather information from terrorist activities or any other threat to the national service. So similarly, we follow viruses, we collect viruses, and we analyze them, and we predict certain predictions, or maybe sharing with the WHO, because we are, our Medical Research Institute, our laboratory, National Influenza Laboratory, is a WHO recognized and WHO designated laboratory. So we have to follow their guidelines, their procedures, practical, and weekly we have to share with our data, and whether it's rising, whether it's the trend is above the last year. Just like dengue, we need to have certain predictions. And I think you raised before this program also stakeholders. We must weekly basis we must email our all stakeholders.
Right. Okay. Speaking of stakeholders, let's also talk about the role of the COVID-19 Technical Committee of the Health Ministry. Speak to us about the continuing role and what measures are taken, what kind of discussions take place.
Yeah, it was first established in 2020, just after the first, I think, if my memory is correct, 27th of January. It's wherever. So after that, there were several meetings, especially when it comes to what to test and what are the methods, and especially control, because the main stakeholders or the committee members, it has something like 50 odd committee members.
Okay.
So every speciality, even a psychiatrist is also there, how to convey a message kind of thing. So it is headed by a Director General, and of course Secretary also, Secretary to the Health Ministry also. Sometimes he has participated previously. So main crucial roles, like for instance, even for lockdowns, we cannot enforce lockdowns. We have to convey to His Excellency whatever the recommendations are. This is so, like every aspect of COVID, crucial decisions and day-to-day next policies as such, whether to accept open the airport and accept people without PCR or with PCR, something like that. A lot of decisions were taken in good faith. Of course, all were not received well, but according to the scientific data available, main decisions regarding health, as well as sometimes interprovincial, those days, if you can remember, in 2020 or 2021, interprovincial cross-border, whether we can go or not, those decisions were also made.
Right. How often does this technical committee meet?
Previously, it was actually once in two weeks. Then of course
When was
it
the
went to
last
Zoom.
time that
I can't remember because there was a Zoom meeting. Exactly, I can't remember. But in the sense, now even though all the 50 members won't participate, there's monthly meeting with the Director General of Health Services that is called Avian Influenza Preparedness Committee. That's a influenza specific committee, but all the COVID decisions is taken. So therefore, it's not replacing the main committee, but almost like members also, the COVID-19 technical members also in the avian influenza committee. So
because we need continued vigilance.
Exactly, of course, that is the truth. You should not take your guard off guard, because I think several Yahoo has reported there's a massive increase in COVID-19 influenza. They call triple-demic. There's a new term coined as respiratory syncytial virus influenza COVID-19 has infected several children in Canada and Northwestern, and their winter is also severe, it seems. Very severe winter they are starting experiencing. So as you correctly mentioned, COVID is not still a history, still a continuing threat.
Yeah. Okay, we can go in for a short commercial break. We'll be right back. Stay with us.
මේ පද්ධති අංශයෙන් මේක මොකක්ද කරන්නේ?
මිනිස්සුන්ට අවශ්‍ය සියලුම ඩිමාන්ඩ් එක එකතු කරනවා. තව ලොස් එක. ඒ එකතු කරන එක හරියටම සමාන කරන්න ඕනේ. මේ මුළු ලංකාවෙම ජෙනරේට් කරනවා.
ලංකාන බලාගාරයේ තියෙන සුවිශේෂී තත්ත්වය තමයි එකම වතුර නැවත පාවිච්චි කරනවා.
ඕන ඕන රෝගවලින් මේ තරම් පීඩා විඳින්න හේතු වුණා.
ප්‍රධාන අවදානම් සාධක විදිහට අපි ගන්නේ අහිතකර ආහාර රටාව. කොහොමද මිනිස්සු ජීවත් වෙන්නේ?
එන්න ආර්ථිකය ඇකිලෙන රටක තමයි අපි ජීවත් වෙන්නේ.
සෑම අංශයකින්ම කඩා වැටිච්ච රටක්.
ඇයි අපි රජයේ වියදම අඩු කරගන්නට කිසිදු උත්සාහයක් දරන්නේ නැත්තේ?
මිනිස්සු බදු ගෙවගෙන මේ රාජ්‍ය සේවය නඩත්තු කරනවා.
සෑහෙන ප්‍රමාණයක් බදු කපා හැරියා.
මූලිකවම මේ වැරැද්ද කළේ මේ රටට ජනතාවද? මේ පාර්ලිමේන්තුවල ඔක්කොම කපා හැරියත් මේ රාජ්‍ය සේවයට යන වියදම නැති වෙන්නේ නැහැ. මේ රටට වැඩක් නොකරනම කොටස තමයි පාර්ලිමේන්තුවේ ඇමති මණ්ඩලය කියන එක. ඇමති වියදම් කප්පාදු කරලාද දැන්? ඔය ඔබතුමිය හොයලා බලලාද ඔය අහන්නේ? අයියෝ ඔබතුමිය බේර ගන්න හදන්නේ ඇමති. නෑ වෙනස් නොවන රාජ්‍ය ප්‍රතිපත්තියක් තියෙන්න ඕන. අපේ දරුවන්
කාන්තා සටන සෑම සඳුදා දිනකම රාත්‍රී 9:30ට TV1 තුලින්.
ඔබ දිය වැඩි ආරෝගියෙක් නම් ඔබේ ඇස් දෙක අන්ධ විය හැකියි.
ව්‍යවසායක සහ මධ්‍යම පරිමාණ ව්‍යාපාරිකයන්ට සමාජයේ කතා කරන්න තැනක් නැහැ.
අපි තීරණය කරුවා හැමදාම බැට කනවද රට දාලා යනවද? එහෙම නැත්නම් අපි විසින් මේ හොඳ පිරිසක් එකතු වෙලා මේ රට දේශපාලන නිලධාරීන්ව පාලනය කරලා හරි මගට අරගෙන මේ රට කෙලින් කරනවාද?
ව්‍යාපාරිකයෙකුට මුලින්ම අර ප්‍රාග්ධනය කියන එක හොයා ගැනීමට අපහසු නිසා අපි ප්‍රාග්ධනයට අවශ්‍ය දේවල් පහසුකම් යන්ත්‍ර සූත්‍ර ටික ස්ථාපිත කළ දෙන විශ්වවිද්‍යාලය.
ජාතික මෙහෙවර සතිය දිනවල උදෑසන 10:00ට TV1 ඔස්සේ.
Welcome back. You're with the People's Platform. We're in conversation with Dr. Jude Jayamaha. Doctor, we were talking about the complexities of COVID-19 and influenza virus, which is fast growing in Sri Lanka. Speak to us about the precautions that pregnant women need to take.
Yeah, first of all, now influenza is a self-limiting illness, but there are certain risk categories or categories where influenza can cause death rather than in an usual non-pregnant or non-elderly one. So these categories, mainly pregnancy comes really high up, because a pregnant mother or a pregnant female has a higher risk of getting pneumonia and similar risk of dying of influenza.
Okay.
So then of course children less than 2 years and elderly, that depends on the definition of elderly, after more than 65 years, and those who are having long-term heart diseases, lung conditions, and diabetes, like so-called medical conditions or long-term illnesses. So pregnancy is a state where influenza can cause pneumonia and of course death. It has happened. If I may relate a story again, in 2016 there was a 6-year-old girl from Lady Ridgeway Hospital was diagnosed with influenza A. And then of course we sent the report, and then of course exactly after 8 days we received a young pregnant mother who had pneumonia from Kalubaville Hospital. Then of course we were informed that her child was at Lady Ridgeway Hospital. Then we quickly traced the previous one, and then of course this pregnant mother who is expecting the second baby was the bystander, I mean obviously bystander of her first child, who is 6 years old. And unfortunately she passed away of influenza. She died of influenza. So that was a tragic story, because the thing is that she couldn't help, and of course mothers are usually, they never abandon their children. So that is another sad story of mother succumbing to influenza. But this is not common, but still as health ministry as well as worldwide we address, and especially a forum like this, we take the opportunity to spread the message. So pregnancy, because it is not a disease status as such, but pregnancy, you are changing the whole female body to accept and to maintain another human body. It's a marvelous thing. Of course, it's not the forum, this forum, but of course, so there are disadvantages, of course, because she cannot breathe properly, and there's a lot of blood volume. And there are several reasons for that. But here the message is actually, if you are ill, like especially during this these 2 seasons where we have this December, January, February, we have influenza more reported, in the sense high, we call high prevalence, and then April, May, June, those are our so-called 2 peaks. Apart from that also, during the other periods, if you are having fever for 2 days and cough and cold, please, I beg pregnant mothers to seek medical advice. I know, especially in an Asian context, it's not practical sometimes. You have multiple roles, in the sense mother has a multiple roles, pregnant mother has multiple roles. I mean, I'm not a cook and get all the things settled, and so, but this Family Health Bureau as well as all the MOHs, they're doing a marvelous job getting this message across our midwives and so-called antenatal clinics as well. So then again, so if you have fever, cough and cold for more than 1 day, we advise day 2 or second day also. Please seek medical advice, and we encourage husbands and other caretakers to encourage pregnant mothers also to seek medical advice. And if you go to your even supermarket or crowded places, please do wear a mask.
Right. Dr. Jayamaha, we also need to speak about preparedness and response societally as well as stakeholder by stakeholder. So how does this concept of preparedness and response work when it comes to schools?
Schools, yeah, I mean, schools are actually schools and universities and perhaps other institutions where people like, big institution. So now, of course, we do have there's influenza preparedness guidelines also, because every 2 years before the pandemic, there was a kind of outbreak proportions were experienced, especially month of May, June, July.
Okay.
So therefore, of course, closure is not the solution, or maybe so. But again, then we come to very basics, like especially now, I think training schools are there, even certain nursing training schools or teachers training schools and all that. So Ministry of Health as well as Ministry of Education has sent those who are ill, please stay home, and they can take leave or anything, and don't send your children also, even though maybe there's a monthly test or a term test. So please do keep your children at home. And then if now for instance, I got some samples from Eastern University 3 weeks back. So they were, the university medical officer has collected, she called me and said that, Dr. Jama, there were a lot of undergraduates from Eastern University, cough, cold, and so we tested the subproportion, turned out to be influenza A. 17 out of 17 samples, 16 were positive, and there were 60 odd people.
Right.
So they were sent to home. It's a university, so I think perhaps 400 or 500 students from different faculties are there. So they, I mean, as I mentioned, it's very difficult to as close as such for influenza and other activities, but university medical officer with their along their vice chancellor and this thing. So if they are in a hostel, please do not stay in a hostel. Please go home. Like so, we have the basic principles, and then accordingly you can take the practical solutions, I guess. And they were really encouraged to wear masks. Not only the medical faculty, but arts faculty and other faculties also highly encouraged to wear masks.
Right. In terms of other key stakeholders, if we take Sri Lanka's prison system, for example, another key stakeholder where safety guidelines need to be adhered to.
During the COVID period, of course, we had this screening program where the remand prison and the prison, especially when there's a what do you call inmate, when they are actually admitted to prison, they were all screened.
Right.
And when they were discharged, also when they get bail, also they were screened and sent outside.
Okay.
So, but we have a very close collaboration with the magazine remand prison, where if they fall ill like respiratory symptoms, they do send us, and even candy also. They have a program, but I'm not, to be honest, I'm not quite sure about the policies as such. But COVID-19 during 2020, we had a lot of samples, something like thousands of samples from all the prisons.
Okay. Okay. From the point of view of the state and the key stakeholder, which is the health ministry, what more needs to be done in terms of publicizing this message of staying alert, staying vigilant?
Yes, I think the Health Education Bureau, they play a marvelous role. But the thing is, now in Sinhalese they say that, you know, if you see, you know, if you hear the same thing, people get bored.
Right.
So I think in a different manner, and social media, and perhaps several, you know, I think every news station, electronic station also may be having to put it into a different format, I guess.
Sure.
And perhaps not to sensationalize deaths as such, but if a death accidentally or you know, rarely occurs, just to highlight what went wrong, rather than saying that this was not there or maybe it's not there, perhaps, you know, late presentation kind of thing.
Okay.
And they do have this Health Education Bureau has, they have this, their Facebook and their Twitter and their WhatsApp messages and all that. And the very, you know, nice thing happened during 2020. There were a lot of young volunteers, especially medical, university students came forward, and they had their own WhatsApp group. You don't believe so, something like 1,000 WhatsApp groups. So once the Health Education Bureau puts a message, they voluntarily share themselves. That was a very nice thing, especially to counteract myths or what do you call disinformation or misinformation. So perhaps like that, that was a very good, you know, a successful kind of a campaign. So whatever, now we'll be telling the same thing, wear a mask, wash your hands and all that, perhaps in a different format. You know, maybe a spot advertisement or a slow line is going, that kind of a thing. Same old message, but in a different way, or in a different format, or in a different taste, I guess.
Messaging.
Exactly.
All right. Before we wrap up, any final words of advice to our viewers? Yes, please. In the sense, now influenza, and of course even COVID is at the bay, but sudden change could occur. So now this is actually especially influenza season, especially the Christmas season is also there. So we anticipate a rise, which is of course, I mean, it's a normal occurrence, but we need to keep pneumonia and other things, especially deaths, at a minimal level. So please do take responsibility. If you are ill, please stay home and use a mask, you know, according to appropriately
according to the situation. And if you are ill, especially after the second day, pregnant mothers and especially elderly people, please seek medical advice from a qualified medical practitioner, whatever, private sector, government sector, present to a medical qualified medical practitioner and examine yourself and just get some medical advice. And especially do not use painkillers like aspirin and others if you are having cough, fever, cold. Those are the key messages that I want to give you to keep influenza and COVID at bay.
Fantastic. Thank you so much, Dr. Jude Jayamaha, for educating us and our viewers. Dr. Jude Jayamaha, Consultant Medical Virologist, Head of National Influenza Center, Department of Virology, Medical Research Institute. Thanks so much, Doctor.
Thank you for hosting, and it's my pleasure.
Thank you very much for joining us, for watching us. Have a safe weekend, and we'll see you again next Monday with the Sinhala edition of the People's Platform. Have a safe weekend. Good night.
I can help.